Now I would like to call Dr. Damaris Magdalene to tell us about Revital Vision Therapy System. Thank you.
Thank you, Dr. Shilpa, for giving me this opportunity. It's not. Yeah, okay. So, very good morning to all of you. I will be talking to you about improving amblyopia in adults beyond occlusion therapy. I have no financial interest. Amblyopia, as we all know, is the leading cause for impaired vision in children and young adults up to 40 years old. There is about 2 to 5% of the world's population. It is basically a cortical deficit that leads to decreased vision in a healthy eye with stereo and binocular dysfunction. Treated early during the critical period when the brain is plastic and considered untreatable after age 9. So the question is, can we improve amblyopia beyond the critical age? For this, we should know what is neural plasticity. Neural plasticity relates to the ability of the nervous system to adapt to change conditions in acquiring new skills, and these new acquired skills are retained for years. There is evidence for neuroplasticity. Visual acuity improvement in adults with amblyopia has been reported in case reports after prolonged patching or when the better eye's vision has been lost or degraded by age-related macular degeneration, cataract, and trauma. Large studies have been done in above 9 years, but they have found meta-analysis and RCTs demonstrated limited vision improvement in amblyopes older than 11 years, even with permanent or prolonged patching. So we have this PEDIC study who have found improvement in children from 7 to 12 years old and 13 to 17 years old, but it is not to that extent. We are in the digital world, that digital solutions, digital devices have a solution for amblyopia. Do they really work? Basically, we used to do this monocular occlusion treatment to improve monocular vision, but it lacks effective anti-suppression effect. Although typically amblyopia exists in a single eye, amblyopia should be viewed and treated as a binocular disorder, not monocular. In order to improve binocular functions, amblyopia should be treated binocularly. Stimulating both sides of the visual cortex with equal stimulus will improve stereopsis and binocular function. We have some reports which says the binocular treatment of amblyopia. What do they say? There is no level 1 evidence to support the use of binocular treatment as a substitute for current therapies for amblyopia, including patching and optical treatment. On the basis of the review of the published literature, binocular therapy cannot be recommended as a replacement for standard amblyopia therapy. PLOS was published in 2021. They also say the same thing. Binocular treatment cannot fully replace the traditional treatment, but to date, it can be considered a valid complementary therapy in peculiar cases. Between 2019 and 2024, FDA has cleared new products for patching, instead of patching in children below 9 years of age. We have this NovaSight and Luminopia. But the only product which has been cleared by FDA in adults, in children above 9 years of age and adults is the Revital Vision Therapy. So what is this Revital Vision? It is a vision training web app that effectively stimulates the brain visual cortex. It's tailored to the patient's specific need. It's an algorithm-based cloud technology. You can practice it from the comfort of your home, easily prescribed by eye care specialists, ophthalmologists, and optometrists. It can be performed at home by the patient's computer. You do it 3 times a week, 40 minutes or 30 to 40 minutes, 30 to 40 sessions, 2 to 3 months. Actually, the size of your laptop should be around about 14 to 15 inches. And the company claims that there is an improvement in contrast sensitivity of about 100%. Visual acuity improvement is about 2 lines, and also improvement in stereopsis and binocular function. So what is the mechanism of action? How does this work on the visual cortex? Revital's scientific vision building blocks are 4. One is the Gabor patch, neuronal lateral interactions, neural plasticity, and perceptual learning. What is a Gabor patch? Gabor patch are widely used in the field of neuroscience, having shown to efficiently describe the shape of the receptive fields of neurons in the primary visual cortex. They represent the most effective stimulation. And the next, what I said is the lateral interaction. Neurons in the primary visual cortex are selective for the size, orientation, and direction of motion of patterns falling within a restricted region of visual space known as the receptive field. So to characterize an image, visual processing involves the cooperative activity of many neurons, and that is lateral interaction, which is helped by in this revital vision. So they also did by experiments how to put the target to the patient. The response to the stimuli presented within the receptive field can be facilitated or suppressed by other stimuli falling outside the receptive field, which when presented in isolation fail to activate the cell. So these were the experiments, and they found just to give the target, it doesn't improve much then when you give the target along with the other flankers. So they found that the neural response with just the target alone, and the neural response with the flankers, and the neural response with both the target and the flankers gave more response. That is because of lateral interaction. So that is the second point. The third is neural plasticity, which I already said. That is the ability of the nervous system to adapt to change conditions in acquiring new skills. And these acquired skills, they persist and are retained for years. And the fourth thing is perceptual learning. What is this? Perception can be modified by performance, and visual performance improves with practice. Repetitive performance of controlled and specific visual tasks. Perceptual learning has been evidenced in a variety of visual tasks and has been found to persist for years. So actually, in order to effectively stimulate the adult visual cortex for high success rate, there is a need for patient-specific visual stimulation in a controlled and repetitive manner. So you enhance neural lateral interaction using perceptual learning technique. Repetitive performance of the specific visual task efficiently stimulates the specific neurons and effectively promotes spatial interactions among these neurons. Enhanced spatial interactions will reduce the noise level in neuronal activity, increase the signal strength, thereby improving neural efficiency, improving the contrast sensitivity function. Improved contrast sensitivity function results in improvement in visual acuity. So this is how they present the stimulus. So 2 computerized evaluation training sessions will identify the patient's cortical deficit using different stimulation types, activating different types of groups of neurons. For example, a meridional amblyopia resulting from specific astigmatism will be identified by the system when the patient is not responding to the GABA stimulation in a specific degree. So this is how they present the stimulus to the patient. So ultimately, this software will identify the patient's specific cortical needs, and it tailors it according to the patient's specific need. Algorithm tailor-based specific stimulation program using the GABA patch with lateral masking technique, and also repeating it. Repetitive strong neural response forms new neural connections at the neurons in the synapse level. So it's a very simple thing. You show the patient 2 display, that is the first display and the second display, and the patient has to identify which one has the 3 GABAs. So if it is, and he is given a mouse in his hand, if it is in the first display, he has to press the left button. If it is in the second display, he has to press the right button. And if the system will provide the patient with the feedback in case it is an incorrect response. So the key strengths of this device is it level of the stimulation achieved with lateral masking. It's tailored to the patient's need, and also ability to stimulate at effective contrast level. So we decided to evaluate the efficacy of revital vision in a challenging group of patients, adult patients with amblyopia following 6 months occlusion therapy. They did occlusion therapy with no improvement. So this was a study done on 45 subjects, and our age of the patients were from 8 to 48. It has been published, and the mean corrected visual acuity improved from 0.54 logmer to 0.32 logmer, giving about 2.2 lines of improvement in vision, statistically significant improvement. And I have purchased this in 2017. Then the COVID had come. Until now, we have done about 223 patients, and now I have followed up about 89 patients with a 5-year period, and there has been no regression to either they maintain the same vision, and there is a 1-line improvement in 25 patients, and 2-line improvement in 21, 3-line in 17 patients, and more than 3-line in 1 patient. And again, there is an evidence of improvement in other diseases like nystagmus, albinism, keratoplasty, Stargardt's, and keratoconus. So there is a broad clinical evidence with 26 clinical studies, lots of RCTs and ongoing RCTs in different peer-reviewed journals. So this is the visual acuity improvement in adult amblyopias. About more than 2 lines improvement has been seen in various studies, and our study has also been included there. And also we have found improvement in albinism with bilateral amblyopia. The vision has improved from 0.38 to 0.18. And also there is improvement when you can try in keratoplasty, albinism, and bilateral amblyopia, even in Stargardt's, congenital nystagmus. It's a retrospective study where the vision improved for about 2 lines. And this is a paper which is going to be presented in APOS, where it's a randomized study with in congenital nystagmus patients aged from 9 to 55 years. There is a significant visual improvement, about 2 lines and more, and also improvement in stereopsis. And also we have studied in keratoconus patient. So whatever it is, vision, when you see vision improvement is, first is what happens at the front level when you capture the image, and that is what the industry does by giving us glasses. And then you have your processing unit, which is at the cortical level, and that is where we have to work on, and that is where this revital vision works. So today the key to optimize visual function lays in addressing the brain as well as the eyes. Thank you.
Thank you, ma'am, for that talk. And now I would like to call upon Dr. Sandra to talk about.
Can we ask some questions?
Yes, we can take a few questions.
Few questions if there's anything. Yes, yeah. No. These are all only 89 patients who have those who come back after 1 year, 2 years, 3 years. We have checked the vision. We are maintaining their records.
Supplement therapy which you ask them to do at home?
No, nothing. Actually, the basic thing is the strabismus should be less than 8 prism diopters. The visual acuity is 660. That is a standard. And I have tried even in optic atrophy patients of counting fingers 3 meters, where you make the patient come close to the screen and do it. I have also seen improvement in I didn't see improvement in visual acuity in nystagmus patient as vision per se, but the quality of vision improved. She's a PhD student. She said, no, I can see very nicely, but when you check the vision, it is the same, but the quality of vision had improved in these type of patients. Yes.
Device lately come up the digital device as an alternative for synoptophone.
Synoptophone.
And then his question is there an option to synoptophone which is digital, right?
Yeah.
No.
I don't think
Yeah.
they're not aware of it.
But by the way, I think hardly anybody uses synoptophone. We don't use it. We treat it as an obsolete instrument. Yeah, that's right. Thank you.
Thank you, ma'am.